I'm going to get started just for the sake of time. So I'm Dr. Carl Martin. I'm an emergency physician that works at Brown. I'm a bit of a wanderer, so I got the lapel mic and the little clicky thing. I work with several people who are here, and a lot of the work that I do has to do with planetary health education in the medical school. Oh, I didn't push the button.
Sorry.
No, it's okay. Now it works. I'm clearly great with technology as well. It's my forte. But today I'm going to be giving a presentation about trees. I absolutely love trees, and I think once you hear this presentation, you'll get a better idea of why I'm so obsessed with trees. Working in the emergency department, we see a lot of conditions that are downstream effects of climate change and anthropogenic changes to the environment. So a lot of this talk is going to be about how trees can serve as an effective public health measure for the prevention of the types of things that we see in the emergency department. You'll also notice that there are a lot of references to other presentations, and a lot of that is because the influence of trees on human health covers a lot of the different topics that are being talked about today. So you'll see references to maternal and neonatal health. You'll see references to heat-related illness, and you'll even see an article from EcoRI that's in here. So these are the takeaway points that I have for the presentation today. First, I think you wouldn't be here if you didn't have some idea that climate change has an impact on human health. Humans, plants, and animals exist in a shared environment. This is this concept of One Health, as we like to refer to it nowadays. This has many different names in the many different fields that exist across research and academia. Some people would refer to it as conservation medicine. But One Health is this kind of all-encompassing idea that humans, animals, and plants exist in a shared environment. Next, we're going to talk about the impact that trees can have on human health. And then we'll talk about how trees can prevent emergency situations, and then reference environmental justice and social justice. And I embrace this concept of environmental justice as social justice, that they're one and the same. So this is what I love to call the circle of sadness. Some people call it the wheel of death. This is whenever I present at conferences that have to do with climate change and health, this is inevitably on at least one of the slides. I always like to joke that we should just bring a bottle of whiskey or water, depending on your choice. And every time you see this, you should just do a shot, because you'll see it in so many different lectures at every conference that you go to that's based on climate change and health. But this is the CDC's impacts of climate change on human health spectrum of diseases. And this conference covers so many areas of this wheel of death, circle of sadness. But this is something that we should all be familiar with. And as you progress through your careers, and if you decide that you want to study climate change and its impact on health, you will see this over and over and over again. Although it's not the cool animated version that we saw earlier, I need to get access to that one. But the whole point of this is to just give the general spectrum of impacts of climate change on human health. And I will say, just as a caveat, some people refer to this conference is called the Climate Change and Health Symposium. I am personally an advocate of this more broad spectrum called planetary health. And planetary health includes climate change and health as one of its subcomponents, but it really looks at how humans are affecting their environment. So it's more of a broad-based anthropogenic environmental change that you look at with planetary health as opposed to climate change and health in particular. So you start looking at things like urbanization, for example, land use changes, and how those can impact human health beyond just the impacts of climate change. So just giving you that caveat that planetary health is something that I am more embracing of than just climate change and health in particular, because it's more of a bigger tent that's all-encompassing. And this is the One Health that I referenced earlier. You'll see these little references throughout many of my slides. Feel free to follow them at your own will, because this presentation cites a lot of different research articles. And to become completely familiar with these topics that I'm talking about in 30 minutes, you'll want to read those articles just for more background and context. But this is the general idea of One Health here, that you have these interactions between humans, animals, and plants. And this is what creates a healthy environment overall. And disruption to these cycles is what causes dysfunction and disorder and illness. And whether that illness is plant-based, whether it's like something like emerald ash borer, for example, or if it's invasive species, like invasive fish species, having effects on humans, or harmful algal blooms, for example. These are all things that interact within a system, a feedback loop system. One Health kind of gives us this general, broader concept of health within the globe, on planetary health, as I referenced earlier. And looking at these feedback loops can help us from both a preventative standpoint, but also from a treatment standpoint when it comes to human health and illness. So talking about changing ecosystems, I know Dr. Wurtzel brought this up earlier, talking about Lyme disease. And in fact, look at this. This is like the same slide pretty much that he showed talking about Lyme disease. This slide is looking more at dengue fever. So dengue fever is something that we've seen really change in terms of its global spread over the course of the last decade, as we've been seeing shifts in warming and wetness across the globe. And dengue used to be a disease pattern that was really, particularly in the Western Hemisphere, restricted to more tropical environments. But what we've seen is the spread of dengue fever to more non-tropical environments. And this projection here is meant to show in 2080 what are the projected areas that may be affected by dengue fever. And you can see that obviously the spread of dengue fever in the United States is not just encompassing more tropical areas like Florida and Texas, but more so spreading up into some of our plains regions. And that's just to indicate that we're seeing shifts across the globe having to do with vector-borne illnesses. And this is meant to reflect kind of that One Health sort of philosophy to looking at disease patterns and prevention and management. Again, this is the Lyme disease slide. You saw this with Dr. Wurtzel. And this is just shifts in the patterns, really, of the vectors themselves. So looking at the tick population as it's starting to spread northward. And what you don't see here, because this is restricted to the United States in particular, is that we're seeing increasing risks of Lyme disease in Canada as well. So as we're seeing changes in vegetation, changes in warmer temperatures, you're seeing a spread of the tick populations, as well as the other species that are involved in the propagation of Lyme disease into new environments. And why is this important? From a clinical standpoint, you're not going to test for a disease unless you're aware that that disease exists. So populations that are in Canada, for example, that have never seen Lyme disease might not be testing for Lyme disease or other co-infections like anaplasma or ehrlichiosis unless they're aware that this is becoming an increasing problem. So physician education, public health education is very important when it comes to these particular changes. But now I want to just show this video about why cities need trees. This might be redundant information for many of you, but I think that this is a very informative little TED Talk video. So I'll just throw this on. And hopefully the volume works. It is not working. It worked when we tested it. Yeah, let's see if I can do that. How do I do that? I warned you that I was not tech capable. I can also just skip through it. It doesn't make that big of a... You sure? Yeah, it's totally fine. Well, we're going to skip through this video. But I'll summarize the video for you. There are some of the main difference with trees in urban areas really has to do with stormwater runoff as well as cooling. When you have concrete jungles, stormwater runoff is dramatically increased. So when you think about that in the context of Rhode Island, you could think about Providence recently, and you can think about when we've had episodes of what might be slightly increased rainfall compared to baseline, and then you see dramatic flooding throughout some of the streets as well as through our interstates. So the stormwater systems that were developed are not capable of dealing with some of the slightly heavier than normal rainfall patterns that we see. You also saw this in New York City about 2 months ago. So the stormwater runoff systems in New York City are designed for a certain level of stormwater runoff. But once you get above that level of stormwater runoff, you start to see massive amounts of flooding. So you might recall seeing pictures of just the New York City subway system being flooded, rainwater just pouring down into there. And that was just with a slight amount of stormwater runoff from the baseline. And trees can actually help to divert a large amount of stormwater runoff. So having green spaces integrated into your urban spaces can help to prevent that sort of flooding. So it can help to prevent flooding. All right. So I love this picture. This is from like a nonprofit organization, treepennsylvania.org. I gotta give them props for their cool tree-related picture, tree-related health effects picture. But this summarizes like my whole presentation. So maybe I didn't need to create all these slides. I could have just like stolen this one picture from Google. But it summarizes all of the ways that trees are awesome. You know, some of these you might not know, some of them you might know. You know, shade helps to filter out UV light, prevents skin cancer, decrease stress, improve healing, and help to keep the air clean. So this is a summary of my presentation, but we're going to go deeper. So carbon capture, trees, this is all probably something, again, that's a little bit redundant to those of you who are in the room because you're probably interested in climate change to some degree anyways. That's why you're here at this symposium. But trees help to suck in the carbon dioxide from the air and produce oxygen. So trees are great in that respect, okay? And I have all these references, these delightful references in case you're somebody who doesn't believe this is true. I doubt you are, but maybe. This one doesn't have as many references because I just assume that you all are at least familiar with the concept of the greenhouse gas effect and how heating of the atmosphere takes place after the release of certain types of gases, including carbon dioxide and methane. This is summarizing the stormwater runoff that I was talking about earlier. So you can see the decrease in runoff when you have trees and green spaces throughout an urban environment versus just a concrete sort of environment. So you can see that this causes quite a bit, this can relieve quite a bit of flooding risk as a result of having trees in these urban spaces. So now kind of summarizing some of the different potential health benefits of trees, really starting out with some of the more obvious ones. So trees in and of themselves in shaded spaces can help to prevent UV exposure. And having prevention of UV exposure can decrease your risk of developing skin cancers later in life. So you think like, oh yeah, well, duh. You go into shade, you're not going to have as much UV exposure. What population is this most important for? Well, it's kids, right? Because cumulative radiation exposure is what's most dangerous. So those of us who work in the emergency department, the people that we don't want to give CTs to are kids. We work so hard to get away from radiation exposure to kids. Everything we do is, no, don't do it. We have like thousands of researchers that are looking at ways of like determining which kid really does need this CT scan, or can we just watch them for a while? So radiation exposure for kids, we work so hard in ED to prevent that. But how many people are thinking when their kids go outside and play, what is their UV exposure going to be? So having trees in preschools, which is this study right here, showed decreased UV exposure to kids. So when you're looking at your preschools or looking at where your kids are going to be playing in their green space, think about what the potential shade cover looks like. Think about the trees that are in the environment that can help to reduce their UV exposure. If there aren't trees at the school where your children go to, start thinking about ways that you can advocate for more shade and more trees in that environment, because that will help to decrease their cumulative radiation exposure. We've heard in several presentations the effects of small particulate matter like PM 2.5 and PM 5 on children. This is to reiterate the importance of trees. So just as trees suck in that carbon dioxide, they also suck in some of this like harmful particulate matter. So think of trees kind of like big sponges. Trees are there to serve as your natural air filters. You don't have to buy a fancy air filter. Just surround yourself with trees. And as we talked about in some of the other presentations, or as we learned about in some of the other presentations, these small particulate air, like PM 2.5, they can get into your blood, they can get into your lungs, and they can get into your bloodstream. And that can cause all sorts of harmful effects. So for children, that can cause things like poor performance in school, poor cognitive performance in school, learning disabilities. For adults, it can put them at people at higher risk of having things like strokes and heart attacks. And that's what we see in the emergency department, strokes and heart attacks. Combined with heat, air pollution poses an even greater problem. So on hot days, you see an accumulation of ozone. And that cumulative exposure of heat, which causes physiologic stress on particularly elderly populations who are at higher risk of strokes and heart attacks, with the exposure to ozone, dramatically increases the risk of those problems. So cardiovascular problems as well as strokes. So trees can help to prevent those effects, prevent those illnesses in two ways. One, decreasing heat exposure. So spending time in the shade decreases your temperature exposure by about 10 degrees Fahrenheit. Now that depends on your location within an urban environment, but generally it's about 10 degrees Fahrenheit. And then the trees also decrease your exposure to things like ozone as well as some of the other harmful particulate matter. So we talked about exposure to UV radiation. We talked about particulate matter and air quality. This is just referencing some of the potential effects of particulate matter. This is a case from the United Kingdom where it was the first case that was actually deemed death secondary to air pollution. So this is a child who had asthma, and it was deemed that the air quality that surrounded her was responsible for the asthma exacerbation that caused her death. So thinking about that, certainly we're seeing more and more impact, again, on our children. And this is an interesting story. It's from 2020, so it's several years ago now, but it's looking at the difference in exposure to air pollution in New Delhi and India. And this is based off of socioeconomic status. So the child on the right, this one here, had access to air purification systems throughout her home and her school, so had minimal exposure to the outdoor environment, whereas the child on the left had exposure, lived in one of this kind of ramshackle sort of slum environments of New Delhi and had no such protections. And you can look and see the differences in the small filters that the children wore that would detect air pollution throughout their environment. And this just highlights, in a visual representation, the inequalities that exist in terms of air pollution and the potential effects that can have. Think in your mind of what the potential downstream effects are for this individual who is having regular exposure to significant air pollution. And this is a child, so these are constant insults that accumulate over the course of life. But we kind of building off of the air pollution, this is the benefits of trees on different pulmonary conditions. So the prevalence of lung cancer, being in an environment that has increased tree cover helps to results in patients having less lung cancer as they get older. Lower prevalence of asthma among children. So that might be something that people might think is counterintuitive, right? So you might think, increased trees, increased pollen, that might actually result in more asthma cases. But in a similar sort of fashion as having pets can help to reduce asthma in your children, it turns out, or at least the hypothesis is that being around trees when you're younger can help to reduce your incidence of asthma as you get older. So it basically primes the immune system in a way that helps to reduce that over-response of the immune system, resulting in things like bronchodilation and the other sorts of problems or bronchoconstriction and the other problems associated with asthma. So being around trees at a young age can actually reduce your risk of developing asthma later. And then this also, again, focusing on children, highlights that the benefits of being around areas that have trees helps to reduce hospitalizations in times of air pollution, high air pollution. So again, these trees act like sponges. They absorb some of these dangerous particles that are in the air, and they prevent irritation in the lungs and can help to prevent the downstream consequences. So again, from an emergency department perspective, these are all great things that can result from tree-filled environments. We did talk a little bit, I mentioned that the decrease in temperature is important. This is something we'll highlight in a little bit. I won't harp on this too much right now, but being in a shaded environment is about 10 degrees cooler than being in an unshaded environment, particularly in urban spaces. This is, this I believe is the EcoRI article, yeah. So this is highlighting why this is important in Rhode Island. You'll see a lot of presentations talking about heat-related illness today, so I won't spend too much time on this, but we in Rhode Island are one of the states that has seen the most rapid warming over the course of the last decade. So part of this is because of our coastal location and the heating of the coastal waters, but part of this is just also due to the fact that we're just located in a geographically vulnerable environment when it comes to the United States. So talking about heat a little bit more, tree cover reduces the risk of heat stroke. So this study looked at areas that had trees versus areas that didn't have trees and patients that would present with heat stroke. Heat stroke is a problem that we're seeing more commonly in emergency departments throughout the United States. This is particularly a problem in areas of the country that don't have a lot of tree cover. So talking about places like Phoenix, Arizona, for example, which saw a record streak of hot days over the course of the last summer. Most of those days over 110 degrees Fahrenheit, but some of those days even above 120 degrees Fahrenheit. And there were reports of people in those environments with heat stroke, but also the ambient concrete being so hot that people would fall and develop burns that they needed to go to the emergency department for. So this is a particular problem in areas that don't have trees, but when possible, having trees and any sort of canopy cover can help to reduce risks of heat stroke and downstream illness. And then I think we talked about this. I know we'll get more information about this kind of reference throughout the course of the day, but tree canopy can help to reduce the risk of emergency department visits on extreme heat days as well. So if you live in an environment that has more trees, you're going to have a decreased likelihood of presenting to the emergency department for an emergency on that day. Moving on in the direction of some more health benefits of trees. So these are collectively 3 different benefits that are probably multifactorial from trees. So one, we talked about the lack of heat stress from living in canopy-covered areas, and we talked about the sponge-like effect of trees. So trees serve as a filter overall for sucking out some of those harmful pollutants that are in the air. And both of those things can cause increase in each of these. So heat causes stress on your physiology, which can release in higher cortisol levels and can affect can affect your blood pressure levels as well as your glucose levels. Oh my gosh. I'm being too crazy with my waving. But we can also, what we'll also talk about in a second is the mental health benefits of being in green spaces. And that's something that I want you to have as a takeaway when we finish with this presentation. And here it is right now. So the Japanese have really done quite a bit of research when it comes to the topic of green spaces and this concept of forest bathing. So forest bathing isn't like going through the forest naked and rubbing leaves all over yourself. It's more this concept of actually just like going into the forest, not bringing your AirPods, not bringing your watch, and just spending time in a green space, just enjoying the ambient sounds, enjoying the scenes around you, and just being there. And this concept of forest bathing is very popular in Japan, and as a result of that, they've done quite a bit of research related to it. In fact, many of these articles are from Japan as well and have come from researchers who have focused on this concept of forest bathing. But what's very pertinent, so forest bathing, usually the research focuses on 30 minutes of exposure at least 3 days a week. So that's not a significant amount of time for most people to be able to spend in green spaces, if at all possible for them to get to those green spaces. What's interesting when you look at some of the articles that are focused on mental health in green spaces, you see that this has actually been shown to be a very effective treatment for burnout. So for the fellow physicians who are in the audience, or even maybe for some of the medical students who have really just been feeling like they're kind of stressed out and burnt out recently, forest spaces and forest bathing can be a really effective way to help to improve your mental health. So in Japan, they looked at individuals who had reported burnout, and then again, they had them spend 30 minutes a day for 3 days a week in the green spaces, and then found that their burnout effectively resolved over the course of 3 months. So this is a very wonderful treatment. What are the other ways that you could potentially treat burnout? Taking a leave of absence from work, or just working through it, trying medications. I think most people would support moving in the environment of more of this type of spending time in nature. I'll just briefly, for the sake of time, talk about some of the crime-related effects. So you might think that having more trees in an urban area might lead to more crime, but it actually leads to less crime. Several studies have shown that having more trees in urban spaces reduces shootings and violent deaths, and then has also reduced crime in general. The first lecturer, Dr. Wurtzel, talked about how heat can create more crime in different spaces. The effects of trees in urban spaces, some people think this might have to do with broken windows theory, this idea that if your environment looks dilapidated, then you're going to act in more chaotic ways. Am I winding down, Allison? Okay. I'll just highlight a few things, and then I'll kind of wrap it up. So reductions in preterm birth and reduced number of small for gestational age births is something that was talked about earlier during the OBGYN presentation. Improved immune function. So again, this has to do a lot with forest bathing. These are mostly studies that have come out of Japan looking at improved immune function and decreased autoimmune conditions. So people who have autoimmune conditions in general, like for example, people with inflammatory bowel diseases, people with rheumatoid arthritis. These are all conditions that have improved with time spent in forest spaces. I will zoom through this real quick because I think that's going to be reiterated in other talks today, but this is a really good article, if you have time to read it, that summarizes a lot of the effects of trees on human health. It's focused on Massachusetts in particular, but it's a really good article that highlights a lot of what we've talked about today and really goes into depth on some of those things as well. This is a cool app that you can use if you're interested in figuring out what the carbon reductions and the benefits of the trees are in your yard. You can actually use this app to determine how beneficial to the environment your trees are. And then this is a picture of me with my family dressed up for Easter, which is a little bit of an out-of-date picture now, but I will wrap it up with that. And then if anybody has any quick questions, I can try to answer them before we're breaking for a lunch, right, Allison? Kate Moretti.
Yeah, so I often wonder, in urban spaces, there's a sad, public park that has one, small tree. What's the definition? What's the definition of green space in these studies? How many trees are needed to forest bathe?
Yeah, I think it varies based on the study, to be honest with you, Kate. I think, what you're talking about is more of fragmented green space. And there have been some studies that have actually shown that fragmented green space is harmful as opposed to having bigger green spaces located in chunks throughout cities, or constant green space exposure, meaning having streets that are lined with trees, for example. The fragmented green spaces, the problem with them, a lot of the studies have looked at disruption in predator-prey relationships. So with Lyme disease, for example, you see the disruption in the predator-prey relationship where you get more squirrels and small rodents that are capable of serving in the spread of tick-borne illnesses. So fragmented green spaces can be more harmful in that respect. But looking at these studies, the exposure to the definition of urban green space varies from study to study. So I think there's not really a concrete definition at this point in time. Cool. Any other questions? Awesome. Well, thank you, everybody. I appreciate you coming and listening.